Need a gift idea? Well, Dr. Kristen Simpson from Simpson Dental is here to talk about a great Christmas present, a beautiful smile. And you say it's a great time to use our remaining insurance we may have for the year, too.
It sure is.
Yeah, tell us about this.
Yes, this time of year you can get that beautiful smile makeover that either you want for Christmas, or you can give a gift to a loved one of a gift certificate for a whitening or maybe skincare products. So that might be a great idea as well for that person that's hard to buy for. And this time of year you do lose your insurance benefits. A lot of people's insurance cycle ends in December, so if you do have any benefits remaining, you want to make sure to use those up, get your teeth cleaned, and make sure they're healthy before you're going into the new year.
Right. And is whitening still a popular thing to do?
It sure is. Yes, whitening is a great way to refresh your smile. We do Zoom whitening at Simpson Dental, so you can get up to 6 shades lighter, which we also give you take-home trays to maintain the shade that you get while you're in the office. So it's a great option.
Oh, that's nice. What about single crowns?
Yes, so at Simpson Dental we have our own lab, so matching a single anterior tooth can be something that's really hard to do to get it to look lifelike and blend in with your smile. So we have our lab technicians that can come into the room, see the patient, make sure everything is matching perfectly to restore your smile. So, a lot of people have had trauma to a single front tooth. If you hit it on the swimming pool when you were a kid or fell off your bike. So it could be discolored, and these are ways that we can fix it with either a crown or a veneer to get it to blend into your smile.
And along that line, veneers, I guess, also a good idea to get them now?
That's right, yes. Veneers are a thin layer of porcelain, and they cover the front and the edge of the tooth, so they can help to straighten the teeth. They can add back any of the missing enamel on the edges of the teeth, and they can even up the color of your teeth. So veneers are a great way to restore your smile.
Okay, another gift idea, clear aligners that will help straighten our teeth.
Yes, so Invisalign aligners or clear aligners can help to move teeth. So if you've had some crowding or some changes in your bite to where you're starting to get pain in some of your muscles from where things aren't coming together properly, you can do these clear aligners, which actually I have them in right now. So you really can't even tell that people are wearing them, and it's a great way to straighten your teeth.
Oh, wow. Okay. And is this also a good time of year to get your fillings replaced?
Yes, definitely. So a lot of times with older silver fillings, they'll start to break down. You'll see a grayness around them, and that means it's time to replace them. So you can replace them with a porcelain material that's a lot stronger, or a gold material if it's in a back tooth. So lots of ways to have a more stable restoration for replacing those fillings.
What if we need multiple teeth replaced? Is that something we could do this time of year?
Yes, so implants are a great way to replace missing teeth. So all we have to do is get a CT scan to see if you have enough bone in the areas where you're missing the teeth to be able to replace them. So there are so many ways we can use implants to replace the missing teeth, and it's a great option to help preserve the bone in the area. So you definitely want to replace teeth once you lose them.
Yeah. Well, Dr. Simpson, you've given us a lot of different ideas for Christmas gifts, either for ourselves or for a loved one. If we want to see all the services that you offer and find out a little more about what you do, where's a good place to get this information?
Well, you can go on our website, wvsmiles.com, or you can call our office, and we can definitely talk to you about all the different things that we can do. So that'd be a great place to start.
All right. Well, Dr. Simpson, thanks so much for sharing this with us.
Of course. Thanks for having me.